Hello, this is Dr. Stanley Lang. Welcome to this presentation, and the topic of today's presentation is, does it last? So what is it? Well, it is the treatment for type 2 diabetes, the natural diabetes reversal program that we promote and would like you to be more aware of if you're not aware of it. The context of this whole approach is what we call the whole person health approach, which is health of body, mind, and spirit, and focusing today again on more the physical part of this triangle, but all three of these areas are really critical when it comes to having good health. And different videos focus on different aspects of that, but really I like to integrate them all every time that I see a patient when it is possible. So the question, does it last, comes up because the typical story with diabetes is that as time goes by, patients end up on more and more medicine, higher and higher doses of insulin to try to get the same degree of control that they had the year before and the year before that. And it's not uncommon to see diabetic patients on many medicines to try to control their blood sugar. So the question is, when you do it naturally, when you reverse diabetes, not just treat it, but you reverse it, does it last? Does it stick? And the answer is yes, it does. And I saw a patient back today who's been using the program that you have access to for more than 10 years now, and his A1C, which is the average blood sugar test, is still below 5.5. And he's been in that range for a long time, for many years. Now, the thing that is interesting about this patient is that he has a genetic defect that drives his triglycerides very high. They've been as high as 1,000, and even in 2012, his triglycerides were 896. Now, you may not know too much about triglycerides, or you might know enough to know that that's an alarmingly high number, and usually a person would be on 2 or 3 medicines to try to lower that. This patient did not want to be on a bunch of medicine to lower that, and he was willing to follow the lifestyle strategies that I put forward for him. Now, it just so happens that the same strategy that reverses diabetes will also drive the triglycerides down. Now, in his case, it was much harder because he's got some genetic issue going on that's pushing his triglycerides up. So he had to be even more cautious over the years to try to keep his triglycerides down. And basically what this means, eating very low glycemic. That means eating foods that don't raise the blood sugar quickly, avoiding them like the plague, so to speak. And it's easy to learn how to do this. Now, over the years, I've taught different variations of low glycemic eating. And there are many people out there that teach diets that focus almost all plant-based strategies. And I have to tell you, these do work. The problem is people won't follow them. Over the years, most of the patients that I started on that kind of a diet just wouldn't stick with it. So over the years, I evolved a strategy that people will stick with. Is still very low glycemic, but it's easy to follow. And that's basically what I've been teaching now for more than 15 years. And this version of a low glycemic diet works, and it works to reverse diabetes, works to get the triglycerides down, and people will follow it. Now, you have to want it, but the dropout rate compared to these virtual vegetarian low glycemic diets is much, much lower, in my experience at least. Now, there may be other doctors that have a totally different experience. I'm just reporting what I've seen over the last 30 plus years. Now, one of the things that is part of this person's visit today is that his triglycerides are all the way down to, believe it or not, 67. Now, 67 is lower than most people that don't have a triglyceride problem. But he's been able, by following this strategy, to get it all the way down to 67, which is dramatically low compared to most people. And this is somebody that's starting out with triglycerides more than 1,000. He's not the only patient I have that has accomplished this, but this just happened today, so I thought I would report it. I also saw another person today that had reversed his diabetes, has done so successfully. And so this is something that you can do if you want to. It's something that is easy to do in terms of the technical part of it. It's not a difficult dietary strategy to follow. And the programs that I've developed will take you by the hand to show you the way. Now, the simplest first way to start to understand this is just to get a free report that you can access by clicking on the link below this video or beside the video, depending on where you're seeing the video. And it's a free ebook. It's called Why Am I Still Fat? And you may not be fat, but if you are, why am I still fat? And click on it, learn about the contributing issues, and you'll also learn something about low glycemic diets at the same time. So I want to give you hope that you can change things. You don't have to be on a pile of medicines. This person is on no medicine for his diabetes, no medicine for his triglycerides, and on one medicine for blood pressure, but just a little bit. So he is virtually medicine-free compared to most people that would have been in similar situation. So you can do this too. And I have hope in anybody that walks through the door, if they want to do it, that they can do it. This is something that does not require advanced degrees. In fact, advanced degrees might get in the way. So I wish you well. God bless, and have a great day.